Hi, I'm Dr. Chris Sear, Chief Medical Officer for Telecare. Today I'm going to briefly summarise the Medical Board of Australia's recently published Telehealth guidelines. Let's get into it. The document starts by supporting the responsible and safe use of telehealth, with video preferable to phone consultations. While not a substitute for routine in-person consultations, the board acknowledges it can be important in accessing episodic care, especially in the rural and remote setting. Nothing too controversial here so far. The document then gives guidance on steps a clinician should take before, during, and after a telehealth consultation. Everything stated here is fairly logical, and I've made a video guide about this already. The link will be in the description. I will point out that it is important that you are in a private environment. We have had complaints from patients about doctors doing consultations in public areas, so please avoid this. Now to the interesting bit. The board says prescribing or providing healthcare for a patient without a real-time direct consultation is not good practice. Now, the board isn't saying standard telehealth isn't allowed. It is, however, issuing guidance against models of care where patients fill out questionnaires and get prescriptions or sick notes without a real-time consultation. The board says, however, it may be appropriate for a patient's usual medical practitioner to prescribe without a consultation in certain circumstances. This guidance does really undermine the model of some telehealth companies, and it will be interesting to see the effect these guidelines have. The guidelines also make a comment on international telehealth. If the patient is in Australia and the doctor is overseas, the board seems to support international telehealth as long as the doctor maintains a registration with the board and meets registration standards. If the patient is overseas and the doctor is in Australia, the board says doctors should establish whether they are required to be registered by the medical regulator in the country the patient is located in, and if they are, to make sure they comply with legislative requirements in that jurisdiction. The guidelines do not comment on Medicare billing or insurance. Remember, for a consultation to be Medicare eligible, both the patient and doctor need to be located in Australia. Regarding insurance, make sure your insurer covers telehealth. Most of them do. However, if you are going to provide healthcare without a real-time consultation, make sure your insurer will cover this. For telecare doctors who do public hospital work, it's prudent to check with your insurer that public patients are covered. Thanks for watching. I'm Dr. Chris Sear from Telecare. Stay safe, stay insured, and see you next time.